Hi, I'm Dr. Katie Tiglio over at the Drake Center. We're going to be answering some frequently asked questions about feline lab work.
Dr. Tiglio, how is blood drawn from my cat?
Very similar to in people. So we use a needle and we draw from whatever part in the kitty that is comfortable for them. Most frequently, that's going to be one of their limbs, front limb or back limb. If it's more comfortable for the kitty, we might draw from the neck, but it depends on what works for them.
All right. Is the sample collection painful for my cat?
It's about the same as a person. So you'll feel, or your friend will feel, a little prick in the area. But other than that, they don't seem to mind too much.
How is the safety of my cat ensured when getting lab work done?
Well, kitties are very stressed out creatures in general, so we always try to minimize stressors as much as possible. We like to keep them in a room by themselves where there's not dogs in the background or people that can scare them. We usually have at least 2 people on the case, one drawing the sample, one holding and petting the kitty, and maybe one distracting if we think that it's necessary.
Why might my kitten need lab work done?
A couple of reasons. Most commonly, we do kitten lab work in preparation for their spay and neuter. So we always want to check lab work before they go under anesthesia to make sure it's safe for them. Otherwise, if there's any signs of illness, so if there's any vomiting, any weight loss, if their appetite is down, and also there's some viral testing we like to do on kittens as well.
All right. Why might my healthy adult cat need lab work done?
Mainly for baseline lab values. We like to track the numbers over time to see if they do get sick in the future, where they started at, and see where those changes happened, how long it took for those changes to happen, and also, as with kittens, to prepare for anesthesia if needed for a dental cleaning or some other procedure.
Why might my senior cat need lab work done?
We like to do it a little bit more frequently in senior cats because they have a higher incidence of disease. Most commonly kidney disease, hyperthyroidism, and again, just baseline to see where their numbers trend over time.
Okay, last question. Will follow-up lab work need to be done on my cat?
It depends on what the numbers are. Generally, we like to check the lab work once a year, depending on the age of the kitty, to see where the numbers are going. And other than that, it depends on what the results are. If you notice kidney disease, we like to monitor those values periodically. If we start on any medication, we recheck the lab work afterwards to monitor the response of the medication. And whenever we feel necessary, if the cat is sick or there's any change in how they're doing at home, we do. The last thing we consider is some additional tests to our screening lab work. Sometimes we add on additional tests like urine culture or extended thyroid panels if it's not completely clear on the lab work what's wrong. And that's all I have for you today. If you have any more questions, call the Drake Center at any time.